Good evening and thanks for joining us for News 8 Now at 6. I'm Amy DuPont.
And I'm Mike Thompson. About 600 Wisconsin hospital beds are filled with patients waiting to be transferred to long-term or transitional care facilities. That's according to the Wisconsin Hospital Association.
News 8 Now's Emily Haugen joins us in studio with what that means for patients in our area.
These people are waiting to leave the hospital, but they have nowhere to go for multiple reasons.
Hospitals and long-term care facilities are feeling the effects of the pandemic.
Unfortunately, over the past few months, we've seen up to 50 patients waiting in our hospital for a nursing home bed.
Now, more than ever.
We have seen those numbers rise very rapidly over this past fall of 2021.
That's not just in La Crosse. It's a strain statewide. John Sauer, the CEO for Leading Age Wisconsin, says the number of long-term care beds in the state dropped by about 1,600 during the pandemic.
We're not able to admit many of those patients because we cannot admit people for whom we have no staff.
As of last week, there were 600 Wisconsin hospital beds taken up by those patients waiting for long-term care. At Gunderson, Dr. Elizabeth Cogbill says this could be from a number of factors.
They have the physical space available, they have the beds, for example, the equipment that they need, but they don't have the nursing staff and the ancillary staff to help care for these patients.
The nationwide staffing shortage, an increase in complex health issues, and the pandemic as a whole.
The longer this goes on, the more difficult it will be to change this problem.
And as the months go on, worker fatigue persists.
While Dr. Cogbill says they're exploring solutions, the pandemic is making it hard to progress. I contacted 10 different long-term care facilities in the region. However, people either did not respond or were unavailable for comment.
All right, thanks a lot, Emily. Though there is a staffing shortage, the Wisconsin Hospital Association also said there's only been a small loss of nursing home staff due to vaccine requirements.
Dr. Cogbill says Gunderson has 7 long-term care facilities in La Crosse County, but some willing patients have been sent to places across the region.